I am teaching the physiological changes in pregnancy. How does pregnancy affect the woman? When a woman gets pregnant, how does pregnancy affect her? We'll be looking at the changes pregnancy brings on the system of the woman. The importance of this lesson is such that we can render quality care, quality antenatal care to the woman who is pregnant. Understanding the changes that pregnancy brings to the system of a pregnant woman is the basis of the reason for quality antenatal care. Every woman who is pregnant deserves care from well-trained, seasoned healthcare providers. When somebody gets pregnant, we understood that in our last video, the pregnancy is implanted in her womb. The placenta forms. The placenta begins to secrete hormones, certain hormones that preserve the pregnancy, that enhance the development, the growth and development of that pregnancy. And we specifically talk of estrogens, we specifically talk of progesterones. And I said that progesterones, they relax smooth muscles, not only in the womb, but all over the body. I said estrogens, they are building hormones. They cause the tissues to grow. So you see, one is like peacemaker, so that contraction should not come and destroy pregnancy. But one is causing the growth. Now you will see that even the growth that is happening in the body of a pregnant woman does not take place only in the womb. It takes place in the general body. Because the blood that is circulating in the system of a pregnant woman is carrying these hormones all over, circulating with it. Wherever blood reaches in your body, these hormones reach. Therefore, my dear brothers and sisters, when somebody is pregnant and the pregnancy is doing well, that woman is going to suffer the effects of pregnancy hormones in all the systems of her body. All the systems, all the organs, all the tissues in the human body are affected by pregnancy in different ways. I will take example of some of the systems and we'll see where the pregnant woman has problems that needs care, reason for which quality antenatal care must be rendered to somebody that is pregnant. One, the central nervous system that involves the brain and the spinal cord, plus the nerves and the whole nervous system. During pregnancy, progesterones relax all smooth muscles, my dear, including the very tiny smooth ones of the brain, and sometimes altering the normal functioning of the brain. Sometimes a pregnant woman behaves abnormal. When I say abnormal, it means unusual. You notice some kind of behavior that you have not seen. You didn't even believe that this your wife, this your sister could behave like this. Yes, pregnancy is torturing her at the level of the brain, and sometimes it may even be because of reduced blood supply to the brain, and a lot of the cells of the brain do not affect their functions the way it is supposed to be. I want to take simple examples like this: an attitude change. We have seen situations where a young lady marries and she and her husband, love flows, and then each time they always hold themselves, they embrace themselves, they kiss, they call themselves babe, they call themselves honey, darling, baby, all the kind of sweet names you can think. Sometimes when the man is coming from work, the lady will quickly get up, embrace him, help him loosen his dress, remove his shoes, do that. And sometimes when pregnancy comes, the man may start noticing that the lady's attitude is like changing. The lady seems to be frowning more often. Some ladies tend to cry over things that don't even need crying. Okay, sometimes the guy seems to be so worried because the attitude of the wife has really changed. Sometimes the husband may even leave food money, and then the lady too may stay home and doesn't feel like cooking. But she instead of explaining that to her husband that she feels weak and so on, she just bursts into tears. Sometimes the man may just come back home, and when he rushes to kitchen, no pay, no food, and then the lady just bursts into tears. It's feeling, in fact, sometimes we tell the man try to cope with it because the pregnancy hormones are dealing with her. Sometimes we plead that when you come and meet a woman in that situation, even beg to tell her that no, you have come back early, you could take her out, maybe you could go and eat something, maybe and so on, or you could prepare something, you can assist her, even as a man, to prepare something even in the house. But if she feels that she has stayed the whole day in the house and there's need to take air around, why not? You can take her again out, maybe you can relax, and the course of that she could eat something nice and so on. Yes, it's already treating this. That is a man who understands. But we have seen situations where men fight their wives. They even beat, they kick, and they go ahead to explain that she did this, she did that, she annoyed me, oh, she got to my nerves, she did that. If you understand how pregnancy affects a pregnant woman, you will never get angry by her actions. Even if she buttons you and slaps you, you will smile and still thank God that someday she will give birth, and this will go off and she'll behave better. I've seen a man that has kicked the wife, beat, just because the wife insulted him, that he and his mother are witches and wizards. The guy said, what? You call my mother witch? She said, I will call you people witches and wizards every day. Are you people not witches and wizards? And see, the guy just got angry and gave very serious stance to the woman. This guy is very ignorant. We are saying that it is important for men to learn that their wives need all their support, and their brain sometimes is being affected by the hormone that is building the pregnancy. If you understand that, you will stay by her and give her all the support, emotional support, all the love, so that after even if she's that one that reacts, but with wildness, some ladies become very naughty and become wild. Okay, that even children run away from her, that even neighbors may not even want to talk to her. Yes, that may be the way pregnancy is affecting her. But it will come to pass, because these hormones will go down someday when she gives birth. Okay, why is this woman calling her husband a wizard and calling the mother of the husband witch and so on? Because of dream. She tends to be dreaming too much. When she goes to bed, she dreams a lot. But we need to teach pregnant women that because of the alteration by the hormone, the central nervous system, your brain, when you even lie down, there's a lot of changes happening. When you learn this thing, you're supposed to ignore the dreams during pregnancy, because the pregnancy hormones circulating in blood, they make you dream a lot, that you may insinuate things that they don't exist anywhere. So even the old lady say, I dreamt about this, I dreamt about this, you only need to cancel her and give her the necessary support. That is how pregnancy is affecting her. So I am telling you, you can leave the brain. Go to the digestive system. You will be surprised that even at the level of the digestive system, she eats, the food goes down. Sometimes the tendency that there's reflux, food wants to come back to the mouth. There's reflux of food. And she starts wondering, what kind of thing is this? No. The progesterone, which is a pregnancy hormone, has weakened the cardiac sphincter, which is the opening into the stomach cavity. So she can eat and it goes down and enters stomach cavity. She may just turn to lie down and food is coming back to her mouth, coming out to her gullet, to her esophagus to reach the mouth. And then sometimes she catches and swallow it again and re-swallow. That's reflux. It is common during pregnancy because the cardiac sphincter cannot close firmly because of the hormones of pregnancy. And this is what causes heartburn. Because when the food goes down into the stomach cavity, it has mixed with hydrochloric acid, which is very normal in the abdominal cavity. Once it mixes there, and the food has to reflux and come back to your esophagus, it is bringing acid now to come and touch where acid is not supposed to touch. And it will burn, it will cause burning sensation. And the lady will say, I have heartburn, my heart. It is not the heart. Okay? It is the burning sensation of the acid that has been brought from abdominal cavity to where acid is not supposed to be. But all of that is common during pregnancy. When the pregnancy goes off, it goes off. And the valve, the sphincter, start closing firmly. And food cannot go in front and come behind again. You can find a pregnant woman suffering from constipation. Yes, because the intestinal muscles are relaxed by the presence of this pregnancy hormone. And so food stays long. Peristaltic movement becomes slow. Yes. So you will find a lot of vegetables and fruits to involve in the food of the pregnant woman to help her cope with these conditions, because you know how pregnancy can affect just that system. The lungs are also affected because even the muscles of the chest, the thoracic wall that need to contract for chest to expand, for the lungs to take in enough oxygen, these muscles are also relaxed by the presence of progesterone. So a pregnant woman sometimes begins to find it a bit difficult to breathe. At one time, it looks like air is short for the pregnant woman. But it's a natural thing. That's how pregnancy is affecting her. What support can you give her so she can go through all of that? Go to her womb, like the reproductive system. What are the changes there? Her womb starts growing. The womb was originally a small organ that could weigh just about 60 grams, okay, and it's inside the pelvic floor. But now you have started growing until it is coming now up into the abdomen and becoming abdominal organ and pushing her intestine and other abdominal organs upward and to the side. A lot of changes. And the woman will not have it easy. Yet she had to carry for 9 months. We need to understand that this is how pregnancy affects the pregnant woman. And so that pregnant woman needs a lot of care. It needs even trained personnel. It needs to seek advice so she can cope with the pregnancy. And it gets to 9 months and she gives birth and everything gradually comes back to normal. And she comes back to life. Now, when you go to the cardiovascular system, that's the circulatory system, the heart begins to beat faster. The heart sometimes is overloaded because there's a lot of accumulation of fluid which dilutes the blood. You see, blood volume increases, but the hemoglobin content inside instead drops because it dilutes inside. And so the heart has a lot of work to begin to do. Yet, the womb grows up, pushing abdominal contents, and they're coming up, they also push the heart and tilt it more. It's like you put water in a bucket, and that bucket is being tilted down, and it looks like some of the water is pouring down. You see, the heart, instead of standing straight, is now tilted. Yet, it has to continue to pump. The pregnant woman goes through a lot. She now needs support from trained personnel to cope with this situation. The changes are enormous. In her kidneys, you'll find that at one time, her kidneys begin to form a lot of, she begins to form urine very quick. You know, the formation of urine is such that she is going to urinate very frequently. But we told you that in most cases, the problem is at the level of the bladder, where the space to store the urine has become small and the pressure increases. Sometimes you now find glucose in her urine, when she is not diabetic. She comes to clinic, they check her urine, it has glucose, to tell you that even the pregnancy has affected the kidney tissues, maybe at the level of the Bowman's capsule, such that with diffusion from the Bowman's capsule, you find very important elements, very important things like the glucose, the amino acids. Some of them begin to cross when there's not supposed to cross. You collect the urine of a pregnant woman, you can see proteins. The type of protein we call albumin. You start seeing her urine, which may also be indicating that the kidneys are not very healthy. Sometimes only drinking a lot of water could cleanse the kidneys. But if the level of the proteins, the albumin is high in the urine, they may need to place her on antibiotics. You see, the pregnant woman goes through a lot of changes in pregnancy. Now, I only took a few examples of how pregnancy affects the pregnant woman to tell us that the pregnant woman needs help wherever we find ourselves. Organizations, individuals, please pay attention to the life of somebody who is pregnant, and you will be blessed. If you are interested, if you like this video, subscribe, like, share, comment. My name is Dr. David Ayim. I am a reproductive health expert. Of course, I hold a PhD in public health, and you can get me on 674-605469. If you are out of Cameroon, start with the word with +237 7 before you add the number. You can get me even on WhatsApp. No direct calls, please. Or you just put your comment on the comment section. Thank you.